Hello everyone, today we are going to see about pancreatitis. Let me explain what is pancreas. Pancreas is both endocrine and exocrine gland which is secreting digestive enzymes and insulin to regulate blood sugar and helpful for the digestion. Pancreatitis means inflammation of the pancreas. This occurs when digestive enzymes start digesting the pancreas itself, resulting in swelling and loss of function in the pancreas. Here is the image of pancreatitis. There are two major types of pancreatitis. The one is acute pancreatitis, the another one is chronic pancreatitis. Acute pancreatitis is a short-term inflammation of the pancreas. It typically treated with supportive care and often resolves completely. In chronic pancreatitis is a long-term progressive inflammation of the pancreas. It will lead to permanent damage and scarring of the pancreas. It worsens over time and it is not completely resolved. Another major types are autoimmune pancreatitis and hereditary pancreatitis. In autoimmune pancreatitis, our own immune cells will attack pancreas. In hereditary pancreatitis, it will from hereditary pathogenesis. How the pancreatitis occurs? It starts from injury to the pancreatic acinar cells. Pancreatic acinar cells are epithelial cells which is responsible for producing digestive enzyme helpful for the digestion. In pancreas, the pancreatic acinar cells secrete digestive enzymes in immature form. Then it will travel through small intestine. In small intestine, it become mature and helpful for the digestion. In pancreatitis condition, injury to the pancreatic acinar cells lead to premature activation of digestive enzymes in pancreas itself. Then it will damage the pancreatic tissue. Tissue damage will lead to tissue injury, sometimes necrosis, death of tissue. In pancreatitis, it will lead to pancreatic tissue death. Activated enzymes leads to further enzyme activation. It will lead to autodigestion, inflammation, tissue injury, necrosis, release of cytokines, which is a protein secreted by our immune system. It will lead to multiple organ dysfunction also. Causes. The major cause for pancreatitis is gallstones. In acute pancreatitis, gallstones block the pancreatic duct. It will block the pathway and lead to pancreatitis. Chronic alcohol use. Heavy alcohol use leading to chronic pancreatitis. It worsens often. High triglycerides, elevated levels of fat in the blood will increase the workload of pancreas. Then it will lead to pancreatitis. Another major causes are infections, certain medications, autoimmune diseases, genetic disorders, trauma to the pancreas. High blood calcium levels will also lead to pancreatitis. Clinical presentation. In acute pancreatitis, patient will have sudden severe abdominal pain, often radiating to the back, nausea and vomiting because of indigestion, because the pancreas is affected by injury to the pancreatic acinar cells. Then it will not secrete proper digestive enzyme. It will lead to indigestion. So patient will have nausea and vomiting. Tenderness in the upper abdomen, because the pancreas is located in the upper abdomen. So patient will have tenderness. Fever and chills. These are all the common signs for the inflammation. Depends upon the condition, the pain location will differ. Rapid heart rate and bloating due to abnormal glucose levels in the blood, because due to pancreatitis, pancreas will not secrete enough insulin to regulate the blood sugar in our body. In chronic pancreatitis, patient will have persistent or recurrent abdominal pain. Patient will have continuous pain through the next is nausea and vomiting, less common in the chronic pancreatitis. Steatorrhea, oily stools and weight loss due to indigestion, loss of appetite. Diabetes mellitus due to pancreatic insufficiency, because the pancreas will not secrete enough insulin to regulate the blood glucose level. Recurrent acute episodes. In investigation, first we will do blood test to analyze the elevated pancreatic enzymes such as amylase, lipase. These are the digestive enzymes which is secreted by acinar cells of the pancreas. Next is high glucose level will indicate the abnormal function of pancreas. Abnormal liver function, high WBC. In imaging, ultrasound to visualize gallstones and pancreatic swelling. In advanced cases, we will go for CT scan and MRI for clear imaging. Next is MRCP and ERCP, magnetic resonance cholangiopancreatography, endoscopic resonance cholangiopancreatography. These are the two major imaging tests for the pancreatitis to visualize through the endoscope. Next is other test of stool for fat, pancreatic function test and glucose tolerance test to confirm the diagnosis. In management, we will do endoscopic drainage or stenting. In this particular management, we will relieve the ductal obstructions and to drain the fluid from pseudocytes or place stents in the ductal obstructions. Pseudocytes are fluid filled sac present around the pancreas in pancreatitis. So we will drain the fluid through endoscopic drainage and we will place stenting to prevent the future obstruction. Next is laparoscopic necrosectomy. In chronic conditions, patient will have pancreatic tissue death, such as called as pancreatic necrosis, tissue necrosis. Removal of dead tissue through small intestine in using advanced instruments promoting faster recovery. Here is the image of previous surgeries. Next is phase 2 procedures, lateral pancreatico-jejunostomy. In this procedure, surgeon will connect the pancreatic duct to the small intestine to allow drainage and relieve pressure in the chronic pancreatitis. Next is partial or total pancreatectomy. Ectomy means removal. Pancreatectomy means removal of pancreas. Partial pancreatectomy means removal of partial part of pancreas. In total pancreatectomy, surgeon will remove the entire pancreas. Removal of part or all of the pancreas in severe cases such as those with cancer or extensive damage to prevent the further complications.